Sometimes people don't start addressing their arthritis until it's kind of too late. Like they've just let this go way past where it needed to be. So for those people, a lot of them resort to cortisone shots, which is, you get an injection of cortisone into your joint and it kind of like blasts out the inflammation and, hopefully you don't have any pain after. Sometimes they work, sometimes they don't. But what's more important to know is that cortisone shots aren't great for your joints, especially if you're getting them over and over again. In fact, they'll increase your chances of the arthritis advancing, and then you definitely need to get a total joint, okay? They cause damage to tendons and things like that when you keep getting cortisone shots, okay? So there are other better ways to manage inflammation and help that arthritic pain, dissipate and actually kind of help the inside of your joint heal a little bit more. Because what they theorize is that the pain you get from arthritis is actually due to what we call bony edema. So it's like inflammation, like almost like in the bone, deep inside the joint. And that inflammation is what's causing you pain. So rather than take a cortisone shot that is unhealthy and just blast it out, your body is capable of clearing inflammation and healing itself. So we want to support that process and help give your body a boost. In our office, we use a combination of something called shockwave therapy and EMTT, which stands for extracorporeal magnetotransduction therapy. Okay. When you use those two therapies combined, it stimulates blood flow, it stimulates all the natural healing agents in your body, and they target that area, the area where you're having the arthritis, to help healing and manage the inflammation at the cellular level. So inflammation, when your cells get a little gunky or stuck because of maybe some chronic inflammation, or your body just not like doing what it needs to do, the bad fluid gets kind of stuck and that needs to go out of the cell so good fluid can come in. And when that process gets stuck, you end up with chronic inflammation. So the EMTT helps to kind of reset that cellular membrane so that this fluid exchange can happen. That sets the breeding ground, if you will. I call it fertilizer for your cells, so that the shock wave can work even better and last longer. And the shock wave is the thing that heals tissue, and bone is tissue. So those are some better alternatives, I think, than going to cortisone.